Hong Kong is grappling with its worst COVID outbreak driven by the Omicron variant. The city is rolling out compulsory testing for its entire population. Researchers have predicted that new infections could peak at a staggering 180,000 a day next month. The city leader, Carrie Lam, has announced testing the entire population for COVID-19. The testing will begin in mid-March for its 7.4 million residents. Stringent rules will be in place until mid-April. Lam reiterated the city's dynamic zero-COVID strategy similar to mainland China, which aims to eradicate any outbreaks at all costs. The authorities have ruled out a citywide lockdown. Schools will break early for summer and will resume the new session in August. It would take up to 3 months to stabilize a surge in infections.
Well, I could not answer your question that whether this wave will definitely be contained within the 2 to 3 months. What I have told you is we hope to make the full use of the next 2 or 3 months, because this is critical. We probably have not seen the peak of this wave. So how we're going to manage the next 2 or 3 months will be extremely essential and critical to containing, but there is no guarantee whatsoever.
Daily testing capacity will be reaching 1 million as residents would need to test 3 times since the start of February. Daily infections have surged by around 70 times. As the city attempts to stifle the virus, the city's government has made more plans for isolation facilities to take some strain off the healthcare system. 10,000 isolation units will be built in 2 new community facilities with the help of China. Some 114 Chinese medical personnel arrived in Hong Kong on Saturday. It was the second batch that has been sent from the mainland. According to researchers at the University of Hong Kong, their updated study shows the number of daily deaths potentially peaking at near 100 by late March. Cumulative deaths could potentially rise to around 3,200 by mid-May. Moreover, in the absence of intensive social distancing measures, the trajectory of the 5th wave is unlikely to change. Lam say the city's vaccination rate should reach around 90% for 1 dose by March, which currently stands at 86%. Hong Kong already has some of the world's toughest rules to curb COVID-19. The restrictions were first imposed in 2020. For more on this, WION correspondent Richard Kimber joins us live from Hong Kong. Richard, good to see you. Kimber, what stoked the latest surge in COVID infections?
That's right, still major concerns here, as you've outlined there. The cases are still growing. I'm actually standing right outside one of the testing centres here where there are queues of people lining up for what in Hong Kong are called compulsory testing orders. That's basically a mandatory test for anybody who lives in a building where there have been multiple cases recorded in recent days. There have been queues of people lining up on the street here through rain and wind in the last few days trying to get those tests done. Now, what the government's doing to extend that programme, as you've mentioned, is a mass citywide test, the first of its kind in Hong Kong, starting next month. Every one of the city's residents will be tested on 3 separate occasions across the month of March and also be required to undergo self-testing at home. Now, anybody who tests positive will be isolated at a wide range of facilities. Some will be newly built or currently being built large-scale isolation facilities. Others may even be public housing units or hotel rooms that have been handed to the government by the private sector in order to help out with this as the hospitals continue to feel the strain from this growing outbreak.
Kimber, despite Hong Kong having the toughest rules to curb COVID-19, will the 3 months that leader Carrie Lam says Hong Kong needs to contain the virus be enough?
Well, that's the good question, and that's something that health experts here are debating fast and hard at the moment. There's a big concern that this idea of a mass testing campaign will be completely futile if the city is continuing to, relatively speaking, go about its daily business. You can see behind me, everybody's effectively still getting on with their day, despite all of the various restrictions on how many people can be in one place at one time and so on. But the concern is that all of the measures that have been taken so far, and it's been a long-running campaign here to reduce social gathering and enforce social distancing, have effectively not stamped out the possibility. saying rather than have, for example, 3 rounds of mass citywide testing, you could just have one, provided the entire city is locked down for a period of, say, 10 days or up to 2 weeks. Some feel that would be a more effective strategy, but the government is adamant that it does not feel a lockdown is necessary. It says it would be too difficult to carry out in a city that's this densely populated, and also they're worried about the economic impact. And that's a major concern because of the heavy drag on Hong Kong's economy over the last 2 years of the pandemic and the 1 or 2 years before that of social unrest here. The government has just released its newest budget. It's scaled back its growth forecasts down to around 2 to 3.5% from the 6% that we experienced in Hong Kong back in 2021. So a major shift down as the government tries to deal with the impact of this ongoing outbreak.
Live from Hong Kong, Richard Kimber, thank you very much for your insights and for talking to us today. WION is now available in your country. Download the app now and get all the news on the move.